Good morning, and good morning to everyone watching on live stream as well. I'm excited, obviously, about everything happening today, both on stage and upstairs at the StartUp Health Festival, but I'm really thrilled about this next panel and discussion because at StartUp Health, we have this term health transformer. You've heard it a lot. For those new to the community, you're going to hear it a lot. For those that have been a part of the community for the last 9 years, you've heard it time and time again. But I wanted to give a little definition here to what it means to be a health transformer, because everybody up on stage today, especially this panel, are truly health transformers. They are the seemingly impossible dreamers. They're the ones who believe that not only is the impossible possible, but they are the ones who every day get up and start again. Despite all the setbacks and the obstacles and the challengers and the naysayers, health transformers are the real superheroes. And one of the things that is so prevalent among health transformers is resilience and perseverance to overcome every obstacle and challenge. We had the opportunity in 2007, many years ago, even before StartUp Health, to meet Dr. Roy Schoenberg as he was beginning American Well. I think he had launched at the end of 2006. We met him shortly thereafter. And the idea of telemedicine was not only, something that a lot of people doubted, but as he described what we were going to do and how patients were going to be served, it was something that, while sounded impossible, he talked about a 20 or 30-year vision for what he was going to do with American Well. You're going to hear from Dr. Toby Cosgrove, who we had a chance to meet in 2013. And we were at Health Data Palooza down in Washington, D.C., and we didn't know Toby very well, but he was just finished his big talk on the stage, and my brother Howard and I got a chance to meet him and invited him to talk to our first 20 entrepreneurs in StartUp Health. And the idea of 20 of our first portfolio companies in a small room at a hotel in Washington, D.C., not only did the head of this major hospital system come speak to the entrepreneurs, but he sat with them for over an hour and a half and then invited us as an organization to come to the Cleveland Clinic every year to their Medical Innovation Summit, essentially rolling out the red carpet for us. And every year we would go back and he would bring the entrepreneurs into the community in such an authentic and meaningful way. And in 2014, Carm Huntress joined StartUp Health as a portfolio company. We made an investment. He has, over the last 5 years, almost 6 years now, built an incredible company in the Midwest, in Denver, that we're excited about not only supporting and being a partner of, but as you're going to hear on stage, the idea of each one of these individuals about collecting relationships, about engaging. And I'm incredibly thrilled for you to have a chance to just get a little snippet into the progress that's been made, how uniquely their relationships are brought together through both StartUp Health and in particular, Dr. Toby Cosgrove. So, ladies and gentlemen, people on live stream, please join me in welcoming Dr. Howard Krein, Dr. Toby Cosgrove, Dr. Roy Schoenberg, and Carm Huntress to the stage.
Thank you. I think I should sit here, right?
Yeah, right. We'll figure out.
I think so.
Yeah, there's a bunch of doctors trying to figure out where we should sit.
All right, tell us. Keep it simple with that.
Oh, well, welcome, guys. Thank you, Stephen. I'll tell you what, that is an amazing story, and it's interesting. And every time Stephen and I talk about the clinic, we talk about how kind you were on that first meeting, and how truly you just right away accepted StartUp Health and our vision, and really incorporated it into your innovation summit, which goes to the point what Stephen was making is you are a true collaborator. You look at everything and you say, okay, we're not going to do this alone. Let's get as many people involved as possible, as all of you and as your relationships with these two gentlemen have grown. So I want to start off because each of you are true health transformers. As a physician, we are sort of stuck in our ways in a lot of areas, and we try to innovate. We try to figure out, okay, how is this going to be? How can we do this better? But the truth is, we're sort of taught that this is the way to do it. So I just wanted to start with you, Toby. as really the first out of all of us who was a true health transformer, what gave you the insight as you were running the Cleveland Clinic to say, there's a better way, and we can do it?
Well, as I've traveled around the world, I always found that there's no shortage of great ideas all over the place. And I used to go and steal shamelessly from other people's ideas. And I realized that there was, and really the way forward was going to be around innovation. And we had to continue to get new ideas and to bring them in and change healthcare, which is a very difficult thing to do. And so I was delighted when I had an opportunity to see someone who really fostered that. And so I was hugely supportive.
Well, we thank you for that. And so moving to you guys, Carm and Roy. So, Roy, you're in healthcare, so you sort of were thinking, okay, I'm seeing patients, I'm practicing. At what point did you, come up with the idea of American Well? Does everybody know what American Well is, right? American Well is really the leader in telemedicine. And for those of you who don't know, the first time we met Roy was probably 2007. Yeah, at a conference. And he was telling us his vision, and I'm a practicing physician, and I was like, oh, is that going to work? And you remember you said, we're doing it in Hawaii because that's the only place that will allow it right now.
Right.
So can you share with us just a little bit about American Well and your journey?
Well, I'm going to try to be brief because it's such a long period of time. We met roughly when electricity was invented. We were, the truth was that when we started American Well, at the time, when you start thinking about, from a consumer standpoint, what you could do with healthcare, you could probably, for the most part, read about it. You could go to WebMD and read some stuff and do a lot of self-help. Whereas in other industries, in parallel, you could start getting things done. You could begin to buy books on Amazon. You could get airline tickets from Expedia. You can actually get transactions to happen, but not in healthcare. So the crazy idea back in 2006 was, let's use this new thing that's called the internet to try to bring in real time patients and physicians together and allow them to actually have live healthcare. And that started it. And we did not anticipate that this was going to take so long, I can tell you that.
Because immediately everybody was like, oh, this is going to work and be wonderful, right?
It made sense, so why wouldn't it, right?
Yeah. And just to move on to Carm, to sort of bring everybody into the conversation. Carm is one of the startup health companies, and he's been with us for since about 2014, and truly an innovator and a change maker and a health transformer. His company is taking medicine and bringing true transparency to it, something that has long been lacking across the board. So can you tell us just a little bit about your experience and what brought you to say, wait a second, we should do this in a better way and let people know what they're getting?
Yeah, I mean, our timeline isn't as long as yours, but I tell a lot of people we're overnight success in 6 years, right? So that's the reality of digital health companies. I started the company for the simple fact, I mean, I now get to say it's 2020, and we still don't really have drug cost transparency for doctors and patients especially. And so we really started on that journey to say, look, let's figure out a way to get transparency in front of doctors, to let them know what a patient's going to pay at their pharmacy today. It's taken us 6 years to get here. I'm happy to say, we're in 320 health systems now. We work with a lot of the major U.S. EHRs, bringing this directly to doctors when they're prescribing. And my mission, my view of the company is we've got to get this to every doctor, every pharmacy, and every patient in the U.S. And that's the way it should work, right? It's we have all these. You can look up the price of literally anything in your life right now on your phone in 2 seconds. Drug cost transparency is an absolute imperative. We've got it as it's really become an epidemic in terms of people going bankrupt over not being able to afford their drugs, and so bringing transparency is one of the first steps to really moving the industry forward. And I'm glad to be a leader in the space now. And we work with about 70,000 doctors on a monthly basis and do millions of these transactions now a month. So it's really exciting.
And the amazing thing for those of you that aren't physicians. Generally, and up until really the last year or two, we didn't know what the drugs would cost. Patient would come in and you would write the prescription. You'd say, there you go. Go ahead and get it filled. And very often a patient would go and one of two things would happen. They would look and the pharmacy would say, oh, that's $300, and they just wouldn't get it. We wouldn't know because they wouldn't call us. Or some patients were proactive enough to call and say, hey, that's $300. Couldn't you give me a different drug? And our immediate reaction was what? Of course I could. Yeah, sure. Now, granted, there's some drugs that you need, but for the most part, you could always come up with an alternative that was cheaper and help with the patient. So, Toby, so you ran probably the most esteemed hospital system in, I would say, the country, but probably the world. You're global. You've brought innovation to medicine. What is it about these two companies? Because for those of you who don't know, Dr. Cosgrove sits on the boards of both of these companies. What is it about these companies that you looked at and said, oh, I got to be part of this journey?
Well, first of all, I believe that we've got to change the way we deliver healthcare. And my first one that I had experience was with American Well. And it came out of an experience that I had with my daughter. We were out in Nantucket, and she gets a rash on her face, and I take my cell phone out, and I take a picture of it and send it to the head of dermatology at the Cleveland Clinic, and it says poison ivy. And I think we just saved a trip to the emergency room, sitting there for hours, going in and getting examined, half a day in the emergency room. And it's one of those slap your forehead moments of, oh my God, why shouldn't we do something like this? So for 4 years ago, we had started a relationship with, at the Cleveland Clinic with American Well, which was after we had searched the surroundings. We thought that this was the best option. And so I was very impressed with not only the concept, but also what they did. And how they performed with us. And then, so when I was asked to join the board, I was a believer in this, and I think that we're going to see a huge percentage of healthcare go distant, virtual. And then as I stepped down as CEO, along came RxRevu, and I knew several of the backers, venture capitalists who had invested in it. And I thought that this began to bring transparency to the cost of pharmaceuticals. And in both cases, I thought that there's a group of people that I'd like to be associated with. I respected what they were doing, and I thought we needed to push in those particular directions. So I was delighted to be part of trying to help them do this. And you can ask them whether I'm helpful or not. They may have different minds, but I'm delighted to be associated with them. I'm along for the ride.
Well, I do want to ask each of you something, because Roy, we're here at a digital health festival. Where do you see, because right, so now American Well, you've struggled through and really pushed through a lot of the legislation and acceptance over the last 10, 15 years to get telemedicine accepted.
Yeah.
Where's it going now?
Well, I just want one remark about what Toby said, and then answer your question. Sure. You can't overemphasize how pivotal a decision like Toby's decision to bring in telehealth into the Cleveland Clinic was on the evolution of this entire industry. Because you have to keep in mind, there was a long period of time where telehealth was public enemy number one. Whether it was the AMA or the medical boards or anybody that you would ask would say, you're going to do terrible things. You're going to separate physicians and patients. And then it took people like Toby to come up and stand up, and nobody can question the medical authority of the Cleveland Clinic to say, this is part of the language that is going to be part of our future. It's not perfect. We're going to have a lot of learning to do and everything else, but we've got to start somewhere. So we did technology stuff, and all of that is great. Yeah. These are pivotal moments in history on the adoption and the acceptance of these technologies in healthcare. That is the importance of that decision.
So I was going to say, so it's mindset that we can do it, and then the collaboration that I was talking about before, that if we're going to do it, we can't do it alone. You couldn't do it alone.
No question.
You couldn't do it alone. But together, there's power.
there is incredible amount of security in the statement, or really foresight in the statement. This is far from perfect. This is the first step, but we got to start taking that first step. And saying that opened up the door. I can tell you stories about the ripple effect, literally like domino that happened following that. But the moment Cleveland Clinic stepped in and said, we're going to incorporate this into the way that we think about enveloping our patients and caring for our patients, everybody started saying, instead of saying, this is terrible, it's going to kill everybody, saying, okay, how can we use that? And that changed the world.
Yeah, and let me just make a point here. I think that innovation really happens at the borders of different disciplines. You've got the healthcare, and then you've got digital. And the two don't understand each other, but when they combine, they can do some really pretty exciting things. And that's where innovation happens. And the more that you can begin to connect those two and understand what's going on in each other's world, I think the faster those things happen.
That's exactly right. And I think that answers your other question, which is, a little bit like if you all think about Amazon, interesting thing, Amazon kind of took a decade to flush the pipes on online retail by selling books. And it learned a lot of lessons about people willing to put their credit card in and out, and websites and so on. And then 10 years later, or a little bit less than that, started introducing everything retail into Amazon. Telehealth is known so far for urgent care, and it flushed the pipes well. We learned a lot through it. It's a simple, relatively easy healthcare transaction. Now that that is over, we have a next decade of revolution of saying, now that we know that that works, let's bring the equivalent of all of retail. Let's think about how we're using this to do cancer. How are we using this to let people gracefully age in their home? How are we doing this to follow up on chronic patients, to discharge patients earlier from... There's a long list of those things where the technology can come in, but we probably needed to go through adolescence.
Yeah.
There's no way that you can, cut the corners there. And I think this is exactly where we are. We're at the pivoting point where we know this thing works, we know it's kosher, we know it's safe, we know people like it. Now let's change healthcare experience with it.
Yeah, I agree.
Absolutely. The interesting thing, and I haven't shared this with you, at my hospital, I actually get the benefit of working with both of their technologies. Yeah. And the first time we made the push for telemedicine, I had a patient who probably drove about 3 hours up and 3 hours back to see me for her visit. And when we started rolling out telemedicine, I asked her if she would like to do it. She said, looked at me, she goes, "Can we?" I said, "Of course." She says, "Absolutely." And so her visit came, a couple months later. And after the visit was done, and it was a great visit, I said, "Well, what'd you think?" She said, "I loved it. Can I show you something?" I said, "Absolutely." And it's a cancer patient, so time is very valuable to her, right? She wants to enjoy her life and she literally she had her computer and she takes it out, and I see her walking up a little, sort of almost like little steps, and then she turns the computer around, and she was out on her boat. And she was in the bay outside of Maryland, and she said, "This is why I love this." And I thought, that's it, revolutionizing how we're going to care for patients. So I have to applaud you and thank you, because you really have made a difference in patients' lives. Carm, I want to bring it back to you. Same thing with Carm. I literally we were talking about 4 or 5 months ago, had ordered a drug, and a ping came up and said, this is going to cost this patient, $260. There's a better alternative, $26. Clicked on it. It was done. Patient got the drug. I was happy. The patient was happy, even though the patient didn't even know. It was seamless. So it's revolutionizing access to care and increasing, I think, patients' ability to actually take care of themselves without going into debt and without having to make decisions. As you've rolled this out and you've developed this company, do you think this transparency is going to move into other aspects of medicine, or do you think it's going to be isolated to pharmaceuticals?
Yeah, I think we had to do a lot of proof in the early years to say, are doctors actually going to change? One of my favorite quotes from Toby is like, doctors need to change and patients need to understand, right? And I think providers, really are in this moment of change, especially with technology kind of coming into their workflows. And so we really had to prove it out. When a doctor does take a lower cost alternative, we see about $60 a monthly savings to the patient. And if you think about a chronic med or something, that's significant dollars over a year period. So I think, and then the payers are saying, okay, there's real ROI here. So I think absolutely, and we've got one payer that's starting to expand into labs, imaging, radiology, really creating point-of-care tools to help providers make more informed decisions. And I think that's really ultimately what the way we think, or my vision for the company. It's all about helping the provider make the right decision. Right? And the way I love to look at it is informed autonomy, right? We've got to give them tools and technologies at the point of care that really work alongside them. I think most of provider burnout, a big chunk of it is just alerting, just, popping in the doctor's face, telling them that they're wrong constantly, which is not really how they want to do their job.
Yeah.
And so, we really believe in sort of leaning into guidance-based tools that live alongside their workflows, that are seamless, like cost transparency, that really guide them to make the right decision. Inside our company, in our teams, we say, hey, the biggest thing is getting the doctor to make the right decision on behalf of the patient. And those decisions are highly complex, right? And getting more complex, especially with precision medicine and where we're headed. So we really want to get to a future where we're thinking about clinical issues, thinking about cost issues, thinking about social determinants of health, bringing that all together to help them make the right decision. Yeah. Today, it's really about just, hey, can we get every doctor using, having transparency at the point of care? Yeah. Sometimes I feel like I'm just a plumber, right? Let's just show them the cost of the drug. Wow, it's amazing. But ultimately, these things are making real impact on patients' lives, and it's pretty exciting.
Yeah. Well, the other interesting thing is you're empowering, which you have to understand. Doctors are a tough crowd. Yeah. Because think about it, you're changing their behavior, but you're still giving them the autonomy to do it themselves instead of having a system that just changes the drug. Because then, the doctor writes a medicine. If they all of a sudden hear, oh, that got changed, nobody even asked me, but you're giving them the opportunity to make the right choice and sort of correct the behavior before it goes any further.
Yeah, I think the two things that we learned that were just instrumental in our growth and kind of understanding provider behavior, we spent a lot of time trying to get this stuff into the workflow in the right way. And, you would say that obviously, the doctor wants to do the right thing by the patient and all these things, but ultimately, they're under such pressure day to day to get their job done. The reality that we got to was that it's about less clicks and lowering their cognitive load. And if you do those things, less clicks, if the doctor has a shortcut to get somewhere, they take it, whether you like it or not. And they'll do some weird things because of that, especially with EHR environments today. And two, if you just give them the answer, if you say, hey, are you okay with this, right? Is this okay? And lowering that cognitive load on them because they're seeing, 15, 20, 30 patients a day, those things are really impactful to helping them. And, I hope one of the derivatives of this business is really helping provider burnout and changing the paradigm there, because technology is still inhibiting them in a big way today, for sure.
Absolutely. So as Toby, again, running one of the most esteemed clinic, hospital systems in the world, I've often heard you said there's a change in medicine. Medicine is moving away from the hospitals and back into the communities. So how do both of these companies sort of fit into that vision? And truly, where do you see medicine going? Do you see it being a system where, hey, listen, the only time people are really going into the hospitals is when they need surgery, and other than that, we're going to strive to do to keep patients healthy outside of coming in and seeing us?
Yeah, well, I think you're seeing that healthcare is changing in a major way, and as you look forward, I think you're going to see a change in where people are taken care of. It'll be more outside of the hospital, more in clinics and at home. And you look at minimally invasive surgery is certainly a great example of that. Then you look at who's going to be looking after them, and it's going to be more physician's assistants and nurses and right now we have 4,000 doctors at the Cleveland Clinic and 2,000 physician assistants, and I think that's only going to be equal in the near future, because there's just not enough docs, 100,000 doctor shortage across the country. The diseases we're going to treat are going to be more and more chronic diseases and less acute diseases, and finally, how we're going to treat them is going to change. It's going to be less and less invasive, and hopefully more and more preventive.
And less expensive, right?
And well, with that, that's the hope.
Yeah, that's hope. Well, we're getting a little bit low on time. I know, but right before we walked up, a couple people had asked, "Oh, you're going to have time for questions." I don't know if they're there. Does anybody have any questions? Yes. We should have a mic somewhere.
Yep, coming.
Oh, we got two.
There you go.
Stereo.
Test. All right. My name is Nate Tang. I'm a senior college student. I've been accepted to medical school. My question is for Dr. Cosgrove. So I read up on the Cleveland Clinic, specifically a Harvard Business School case study on the clinic, and I was intrigued by your leadership and vision and direction on the value-based care that was talked about in the case study. My question is pretty simple. Do you think that the value-based care model that Cleveland Clinic undertook is the way that the industry, as well as other health systems, should follow? What are some of the good, the bad, and the ugly, and what are your thoughts and convictions on that?
Yeah, I think that we've been now 12 years moving gradually towards value-based system, and I think one of the big things that's going to happen this year is Medicare now is going to be paying 50% of their payments are going to be around value-based systems. And I think that will continue to push. Certainly insurance companies are going the same direction. It's very slow, like most things in medicine, but I think we're coming to a tipping point right now that's going to be pushed by Medicare. And frankly, I think it's great that people are now worrying about keeping people well instead of only seeing them when they're sick.
Fantastic. Yep. We have maybe time for, sure, there you go. One or two more.
Hi there, Dr. Cosgrove. Great to hear from you today. I'm Natalie Hodge, founder of Prevent Scripts, and I have a question for you. This goes to any other healthcare CEO that's in the room today. How are you going to align incentives between your specialty group and your primary care group, given that the specialist will be making less over time, and your primary care providers will be providing more value?
Yeah, so I'm not sure that's a simple answer, but let me just tell you how we
How are
pay.
you going to do it?
No, let me tell you how we pay people at the Cleveland Clinic. First of all of us are salaried, so there's no financial incentive. What we do is we look at the pay that happens across the United States for a particular specialty, and we try and pay in the 70th percentile of that. Some people who are, and we have research, education, and clinical care, and all of those figure into what your major contribution to the organization is. And if you are doing X number of things plus writing papers and teaching, you'll get paid more than somebody else who's just doing X number of whatever it is. So, and I think I love the model because I could honestly say to someone, you need a heart operation and it's not going to make any difference in how much I get paid.
Great. Sure, one more question.
Hi, my name is Emily Feenstra. I'm from Henry Health. Our health moonshot is increasing the life expectancy of Black men by 10 years. They have the lowest life expectancy of any population subgroup. And the thesis is really that low life expectancy can be tracked back to untreated stress and mental illness. So I wanted to follow up on this point that in telemedicine, it really started with urgent care and can transform the system. And I'm really curious how telemedicine companies and providers using telemedicine are thinking about expanding to other specialties, particularly as you think of buy versus build, and whether you really build out those services yourself as opposed to acquiring companies started off in other specialties.
Yeah, that's a great question. So the first thing I would say is that we see a whole onslaught of additional services beyond urgent care that are coming in. Behavioral health has definitely led the way. The thirst for behavioral health services across the country is unbelievable. We have tried to do as much as we can to build a supply. We contracted with a couple of groups. We brought more physicians, more psychiatrists, therapists, and so on. But the real answer to your question is actually that there's no way that we as a single company are going to be able to deliver that, correct that around the country. What we have to do is we have to work very diligently on bringing those technologies into where the clinicians are in real life, not working for us, and allow psychiatrists, psychologists, and other providers from inside the community to surface their cycles and distribute them through telehealth to all of those places that are challenged. If we really build that, if we look at telehealth as a switchboard for redistribution of healthcare services, we're going to have more than just economic good, we're going to have a lot of social good. And I think that's a big part of the consideration.
Yeah, let me just add two things to that. Our biggest user of telemedicine at the Cleveland Clinic has been the Neurologic Institute, which includes neurologists, neurosurgeons, and psychiatrists. And this is a tremendous opportunity. A lot of people would rather talk to a screen than they would to an individual in person. The second point I want to make is I think we've all underestimated in the past the influence of the social determinants of health. And interestingly, if you look at healthcare providers, we're not paid to look after those. We are not trained to look after those. We don't know how to do this aspect of things. And so what we're seeing is increasing interest in beginning to partner with all the agencies around the community that look after those sorts of things. United Way, for example, is a big partner, and they're stepping out and looking at things like lead paint and housing across the organization. But if you look at the social determinants included housing, food, education, jobs, income, all those things are 60% of somebody's health, way more important than the physical administration of healthcare in terms of people's longevity and their wellness. So we've got, and the common denominator of those is really interesting. The common denominator is poverty of all those things. So clearly, that begins to say, okay, do we need to talk about minimum wages? As part of that. So that goes way beyond healthcare into our entire society and how we begin to think about what we can do that. And to sort of put an emphasis on that, if you look at the longevity in Western Europe, it's greater than the United States, but the cost is much less, and they spend more on social programs and less on healthcare and have a better result.
Awesome. Well, I think we're out of time, but you can see, ending on Dr. Cosgrove's sort of last point, right? This goes beyond healthcare. This is really, it's the human community. Every aspect of what these innovators and health transformers are doing are affecting and changing lives on a daily basis in multiple ways. It's not just the fact that we have telemedicine or that we're looking at transparency. It's really changing the way we take care of each other. So I want to thank all of you for being here and for doing what you do. You're making the world a better place, so thank you.
Thank you.
Thank you.